dear friends, today we are going to discuss about a beauty topic, that is asphyxial death. So, as a question comes in our university exam, we shall discuss in that way. The first thing is that what is the question according to the asphyxial death? That is classify death from asphyxia. What are the different modes of death in hanging? How will you diagnose death in from antemortem hanging? Give importance of a postmortem feature of a antemortem hanging. So these are the four subheading in that way, the 5 up to 20 mark. Okay, this type of a question will ask in your exam regarding to this topic. So first thing what question asks, that is classify death from asphyxia. So type of asphyxia, that is hanging, strangulation, suffocation, choking, traumatic asphyxia, drowning. So below here you can see a diagrammatic picture and you can understand how these things will be happen. So first hanging, here you can see at the neck there is a rubber is surrounding to the neck, so that is the hanging. Then what is the choking? That is person gives his hand and provided some stock or anything which causes the choke of the mouth by choking, and suffocation is that type. Strangulation including throttling, all these things are throttling means a person who give the congestion or inside the neck. Then traumatic asphyxia due to the choking, and drowning during the any type of a sea beach or any watery inside the watery what are things occur, that is drowning. So now by one we discuss, that is hanging. First we discuss hanging is what? It is a condition where there is a constriction of the neck because of a ligature around the neck. You can see in the picture, the contracting force being the weight of the body or that head. That is contracting means the driving force is the weight of the body or weight of the head. The instrument which used in the hanging, that is rope, grills, dhoti, sari, iron chain, belts, telephone wire can be used as a material for a hanging. What are the sign and symptom of a hanging? Symptom which we perceived by the patient are loss of power with sensation of a flash of light, hissing sound in ears, followed by loss of consciousness. Convulsive movement can occur in the judicial hanging, whereas a respiration stop before heart ceases to pump. That is sign and symptom of a hanging. Then what are the types of hanging? In types of hanging there is three types, that is complete hanging, partial hanging, typical hanging. Complete hanging we know. Partial hanging means a certain amount of force around the neck is sufficient to constrict and cause death. This is found in case of a partial hanging. Partial hanging is one in which body is found in sitting, kneeling, reclining, or even in upright posture with feet touching to the ground. Then such as in case of a partial hanging, what happened? The weight of the head is the operating factor, means it is partial hanging, weight of the head is main. Cause of death in partial hanging is confusion because the rapid loss of consciousness is occur. The person cannot recognize the fact that his life can be saved if he moves his body in order to relax the ligature. Thus it is not necessary for the body to be fully suspended. Sometimes what happened, a typical hanging where that what happened, the suspended by rungs of a hand ladder, that is on the slipping down while climbing it. You can see in the picture. Now we discuss the mode of death during asphyxia. First point is that in the asphyxia, what happened in this mode, there are two possibilities. What is, if the ligature is above the thyroid cartilage, then what happened? If the ligature is below the thyroid cartilage, then what happened? Above the cartilage, what happened? There is asphyxia result because of the tongue is forced up and back against the posterior pharyngeal wall. So that what happened? The pharynx become blockage and the floor of mouth against the roof, so that the air can pass through this pharynx. But when the ligature mark is below the thyroid cartilage, then death is due to the pressure on the windpipe, that is trachea. Here the pharynx is the point where the blockage occur during the above the thyroid cartilage if the ligature will be occur, and below the ligature thyroid cartilage if the ligature occur, then there is the death due to the windpipe, that is a trachea blockage or pressure in the trachea. Okay, death due to the apoplexy. So what happened? The compression of a vein, especially jugular vein, at the upper part of the neck, thus causing obstruction of the venous return, leading to engorgement of the cranial vessel. This leads to extravasation of the blood over the brain, and asphyxia and epilepsy from the commonest cause of death in hanging. That is the asphyxia or epilepsy. These are two things which is commonly appear in the death during the hanging. Whereas during the hanging there is also a cause of death that due to the fracture or dislocation of a cervical vertebra. What happened? Sudden long drop, that is a drop which comparatively more than height of the victim. This happened in the judicial hanging. Judicial hanging, what in that time what happened? Government ordered that there is the cause of a backward dislocation of a C2 or C3 or C4, C3 and C4, or actual fracture of the body of the C2, that is odontal pressure, that occur and which causes the dislocation of the fragments presses on the medulla where the vital center is present. And if this tearing occur that place, there will be intima of a carotid artery becomes tear to vagal inhibition. What are other? That is cerebral ischemia, which leads to compression of a cerebral artery, leads to the death during hanging. Shock also due to the vagus nerve pressure, there which is stoppage of the heart due to the vasovagal effect, which causing also death. Now what is the fatal period? Fatal period is the judicial. In the judicial hanging, death is instantaneous, whereas in the complete asphyxia there is a death during the 5 to 8 minutes. In case of apoplexy, there is a death which is slow. Why? Because of the diameter, strength and the tightness of the ligature material, because of the weight of the victim, because of the period of suspension. Now we go, what is the treatment during hanging? If the death will be occur or anything, if we find the person which causing hanging, then if you treat, then constriction should be released by cutting the ligature after rising in the body. Then if we see that the person is wants to hanging, at once we should give the artificial respiration, which is started by the Silverst method. What is it? We discussed later. The tongue should be pulled out and mucus should be wiped out from the mouth, pharynx and nostril. IV intravenous infusion of a venation may be done to supply maximum oxygen, which leads to the feel better to that person. A mixture of a 5% CO2 and O2 is given. Ammonia solution inhalation with cold infusion to head is preferred. Stimulant should be given. Warm blanket or hot bottle may be necessary to keep one correct mental aberration. So these are the treatment we can perform. Then postmortem appearance. External postmortem appearance, what is? Ligature mark on the neck we shall find. That is, it is important observation by medical jurist. It will depend in various conditions, such as the mark is clear and deep in case where the width of the ligature is small in contrast to ligature of a larger width. So smaller width having clear, whereas larger width will be deep case. Then situation and the shape of the ligature is oblique in front, starting from the upper part of the neck in between thyroid cartilage and chin, directed obliquely upward along the line of the mandible. Mandible going behind the ears. So this mark deficient on the one point of the neck, which usually nape of the neck. That is the important. Then the appearance of the mark is dark brown in color. Then will be dry, hard, shiny. Skin is leathery to feel, which is known as a parchmentization. The knot area is represented usually as a triangular area of the parchment below the ear. The margin are usually clear cut. There will be no aberration. The number of ligature marks, sometimes 2 or more marks can be seen, which indicated what is the number of ligature has been passed round the neck twice. Depth of the mark gives idea of the period for which weight acted. Then neck is length. If the duration of the hanging has been long, saliva trickles down at the angle of the mouth from the opposite side of the ligature knot. What is angle of mouth? You should know. If you know, then you see in the picture. Postpartum staining is seen most upon the lower limbs, that is, hands are usually cleansed, urine and fecal may be expected. All organs are found congested, swollen, and turgid. Onset of rigor mortis is delayed. Whereas internal postpartum findings are tissue below the ligature are white, glistening, parchment might. What is parchment? We discussed. Devoid of blood, as seen as body suspended for a long time. There may be injury of the underlying tissue. Second point is that medial and inner coats of the blood vessel are ruptured and lacerated. Third point is the fracture of the hyoid bone is rare, whereas fracture of the thyroid cartilage is rare. Fracture of the upper two cervical vertebrae is usually seen in judicial hanging. Medico-legal importance of the aphasia. First is that the commonest question which faced by the medical officer in the court is that whether it is death due to hanging or any reason. If we have the careful examination of the ligature mark, external as well as internal, trickling of the saliva, postmortem sign of aphasia such as protruding of eyes, tongue, petechial hemorrhage on the face, absence of the signs of a struggle. These are all hanging, homicidal hanging. Whereas to confirm whether the hanging is suicidal or homicidal or accidental, now we get the common hanging symptom. After that we should divide it into suicidal, homicidal and accidental. If the factors are present, that hanging in most cases of suicidal is unless otherwise proved, age is no bar to suicide. Accidental hanging is rare except in the children. Nature of the ligature and mode of application. Circumstantial evidence. Mark of the ligature. Mark of the violence and struggle. These defined as the hanging of a difference between antepartum hanging and a postpartum hanging. In the postpartum sign, what is in the antepartum hanging is that variable according to the mode of death. But in the postpartum there is a clear cut. The cause of death we can find ascertain. Ligature mark in the antepartum hanging is non-continuous oblique high up in the neck, whereas postmortem is a continuous lay circular low down to the leg. Knot in the antepartum is single tied or other side of the neck, but in the postmortem, that is as rule more than one lies in one front. Ecchymosis in the antepartum hanging is that mark on the other side of the ligature. Postmortem staining is found above the ligature mark as well as in the lower